Okay, everybody can hear me? I'm ready to go. Yeah, I just have my water here as I'm getting over a cold in case you're wondering. So I did my practicum on healthy public policy, reducing alcohol harms and costs on Vancouver Island. And I respectfully acknowledge that I am presenting on the traditional, ancestral, and unceded territories of the Lekwungen peoples, including the Songhees and Esquimalt nations. I recognize the ongoing impacts of colonialism and commit to continued learning and action toward reconciliation. So I was in the portfolio of population and public health on Island Health, which is kind of a larger portfolio that takes in health promotion, protection, and reducing inequities. So a movement towards community care and kind of coming out of that medical model. And then my team was the HPP team, who I see there. Shout out to HPP, who are really great and amazing, and they focus on evidence-based recommendations, interfacing with the community, building capacity, and then challenging and analyzing social norms. Whoa. So thinking about alcohol use in Vancouver Island, which was a big focus of what was going on for the team and what was in my practicum. There's high alcohol consumption on the coastal BC communities. Some of the key harms are injuries and accidents, and not just like car accidents, but just accidents that can happen with that impaired motor skills. Chronic disease, cancer is one, and that was a surprise to me coming into this program. It's not something that's really talked about. Mental health impacts, so anxiety and depression. There's a strain on the healthcare system, and this is compounded with access to rural and remote care. And this is something that came up a lot yesterday too, is that care to remote areas is inconsistent, and it does make it harder for health outcomes. Oops. So taking what I learned in my practicum, then I thought I'd apply it to what we were doing in school, which is the socio-ecological model. So this is a great way of framing what we're doing in healthcare, and I found it really valuable. So on this diagram that I have here, the child is at the center, and it was initially a developmental model, so it was more focused on the child, but you can just substitute individual here. It's just the unique person and the environment that they surrounded themselves. So if we're looking at the microsystem, that's just your immediate environment, the people right around you. And then mesosystem is like one spot removed from that. So that's not your immediate family, but people who come in and out of your life. And then the exosystem is more like municipalities, school boards, that kind of one step further out. And then the macro system is that larger social, cultural values, and that's a big part of where HPP comes in, this idea of shifting norms, absorbing the information, and then having it change on a larger system level. And then there's also the Chronos system, which was one that I really liked for learning. It's the idea of shifting norms as time progresses, and so that was really an insight that you don't always think about, but a really good example was COVID, where time moved when the pandemic came in, and then all of a sudden everything else moved too, secondary to this Chronos system, this movement over time. And so it's a critical piece of thinking about how all these systems play together and how they affect health outcomes. I'm just going to take a quick so looking at the macro system, so this is kind of what we were doing. Well, not kind of, this is what we were doing in the HPP program. So what are the long-term regional and provincial strategies? And then coming into the exosystem, that was professionals that we worked with who were an intermediary between that larger macro system and the exosystem. So they have this really unique role of being able to bridge policy and evidence with communities directly, so local partners, governments, to improve health outcomes. So it's a unique opportunity to take both and then make them meaningful outside of the more academic context. So taken from that, I just wanted to do a case study on how you operationalize the SAM approach. So looking at the alcohol-related harms, which is what we focused on a lot, and then where the community health promoter's role is in that is taken with a case study of Tofino. So Tofino has significantly higher alcohol-related harms than regional averages and provincial averages, especially in hospitalization and mortality. So that's really significant and something that needs to be addressed for the community. So if we're coming at it again from the macro system, then these are the initiatives that come out of policy. And this is Island Health's big push right now, is to reduce the harms associated with alcohol use on the island, and then a broader provincial initiative as well. So if we go with that policy, then we're coming into the ecosystem, and these are the concerns that are raised by the community. And this was something that kind of started to happen as the community was more aware of things, and first responders and healthcare professionals were typically the ones who saw it the most, at least initially, because they are managing the immediate outcomes of alcohol use and the secondary effects of that. So they kind of brought it to the community. There was another example, and this one's really dramatic, of bootlegging, and a community health promoter I worked with talked about how people were able to go in and buy large amounts of hard alcohol and then bring them into dry communities and then sell them for more and kind of make almost like a business out of that. And it's really exploiting people, and it's a corrupt system. So there was kind of those components, and community members saw it too, right? It's something that's part of your community. It's something that you see as you participate in your life. And then within that, there's the complexities of social norms. So in Tofino, there's other components too. There's a community that's very aware, but there's also, a tourism business there. So there are certain businesses that don't want the limit set on alcohol sales because it could affect their bottom line, and so that's important to remember. And there was also kind of, within Tofino, there's not always a permanent people living there, so there can be people who are only there for a few months at a time, and that changes their investment and their awareness within the community. And so that is a bit of the pushback that was kind of happening while the community systems are trying to put these differences into place. And this is where the community health promoter comes in, right? Because they're Island Health on the one hand and they're the community on the other. So they're kind of that interplay between all of these different components that are going to affect health outcomes across the board. And one of the really cool outcomes of this, and this is not a solution to everything, but they did limit how many hard alcohol you can buy at one time. So prior to this, I don't think there was really any limits, and now I think it's 2 of the big 2 sixes of alcohol. So that's a really great limit on that exploitation that they were seeing. So from there, I just wanted to talk a little bit more about the community health promoters at the CHPs, because they do have a really unique position within the socio-ecological model and within Island Health. So it's important that we really address that and support them, which I know the team is really doing. So one is knowing the community. So for a CHP, you can't always know your community just because you're maybe in a whole region on the island potentially, and so you've got a bunch of different communities. So there's not always that opportunity to connect and be known by your population, which is really critical in terms of being able to have those outcomes if you do feel like you've established a trust. And then there's also an important component of systems interplay. So if you're a community member, then you're going to be, you're going to be part of the meso system, but you're also going to be, you're going to be part of the community too, right? So what you see at work is also what you see in your life. So the disconnect between work and personal life isn't always there. And so that's also something to really remember, is you're coming in with more of a weight potentially than somebody else. And these are going to be things that will affect your life as well. And this is something that HPP is really supporting CHPs with, and this is specialized training. So if we're thinking about something like alcohol, it has the potential to be really loaded, and so being able to get training on how you address potential conflict or hostilities is helpful, and it's is ongoing, because you can get pushback and it's not necessarily where you anticipate it to be. And the MHOs and the people that I spoke to did kind of highlight that you don't always know which way it's going to go, and you also don't know what the community's at. Oh, okay. Island health goals and community goals can be different, and outcome measures aren't always obvious. The outcomes take a long time to see, and that's kind of part of public health. We need to do a shout out for what we can do, and it takes longer, but it means a lot. The end.